Hi, my name is Andrea.
And my name's Asif.
Today we will be analyzing NPR's COVID-19 daily updated dashboard. The audience here are the general American population with the goal of providing clear and concise pandemic information. The data used is from the Center for System Science and Engineering at Johns Hopkins University, U.S. Federal Department of Health and Human Services, University of Minnesota, and Centers for Disease Control and Prevention. Here's an overview of the 4 different components of the dashboard that help to tell the story of how the COVID-19 pandemic is impacting the USA. The story begins by looking at the severity of COVID at a state level, then at the number of hospitals being overwhelmed, followed by vaccination rates by state, and finally exploring the current spread of COVID around the world.
And throughout the presentation, we will be relying on Cole, Nussbaumer, and Knaflich's book, Storytelling with Data, to help structure our analysis of the visualizations.
The first component of the dashboard is looking at COVID-19 cases in the US. These side-by-side visualizations display COVID-19 cases and deaths in the USA. The use of text below to indicate data irregularity is helpful to contextualize the information. A histogram is useful here since NPR is reporting on continuous time data that cannot be rearranged. From a storytelling aspect, the visualizations really demonstrate the first and second wave of COVID in the States when it comes to deaths. Notably, we can see that the deaths that occurred from COVID during April did not have the corresponding amount of reported cases. This is perhaps due to the lack of testing in the US during this time.
We are now introduced to an interactive hexagonal heat map, which displays the level of risk in each state. Using this visualization depicts only the pertinent information to the audience, in this case, only in terms of highest to lowest risk. This method helps reduce our cognitive burden in consuming such technical information. From just looking at this visualization, the audience can immediately recognize that Florida, New York, New Jersey, and Rhode Island are currently the highest risk.
When hovering over a state, we are provided with more details regarding the average number of cases per day and number of cases per 100,000 people. This visualization is very accessible as it provides a quick and easy way to understand the risk in every state. The states are positioned in a way that represents their geographical position on a map of the US, so it is easy to locate the state you are interested in learning more about. These are also valid data comparisons because they use the same measures such as cases per 100,000 people. The heat map's utility is also recognized by NCK. A reader would find themselves scanning across the hexagonal map to get a sense of which states are highly contagious, where numbers are higher or lower, and mentally stack rank the categories presented in the table. NCK specifically notes the use of color to assist the reader's gaze into the pertinent information.
Moving on, this chart here is used to display the trend of average new cases and deaths on a daily basis compared to the state's total to date. This type of visualization is useful for detecting the trajectory of the virus's growth based on a weekly accumulation rate. The curve bends upwards as new and total cases increase and downwards when they decrease. An issue with this visualization, though, is that NPR doesn't enable muting the New York data line.
So you can use the drop-down menu to select a state to view its curve. New York ends up being a mandatory benchmark that we have to use in comparison to whichever state we want to look up. This decision is not made clear and results in the chart visualizing what is essentially a false equivalence. The population density, housing policy, and food security issues that exist in New York and require mandatory travel by some of its residents are not applicable to Vermont, for example. It would maybe make more sense to compare urban states with other urban states such as New York and Illinois.
Yeah, definitely. And funnily enough, you can see that if you select New York, it doesn't compare the curve to any other state. So perhaps NPR has some user data that suggests that New York has its largest readership. Be that as it may, this is confusing as the researchers don't explicitly explain why New York is used as the benchmark. Furthermore, it may have been useful to show the virus's growth over time instead of just total case growth. If the rate is increasing, intuitively, we know that the aggregate amount of cases will also increase. In terms of storytelling, A more salient indicator to track would be the when. This way, a storytelling question that you would be answering for readers is, did the cases see a spike over the Christmas break?
This map shows total cases by state across the country. The visualization is interactive, so if you hover over the state, you can see details for the total cases, cases per 100,000 people, total deaths, and deaths per 100,000 people. California, Texas, and New York are labeled to highlight that they have the most confirmed cases and deaths. The size of the circles is used to demonstrate the number of cases or deaths. The greater the number, the larger the circle.
This interactivity between the cases and cases per 100,000 is quite well done. When we look at cases per 100,000 people, the circles of California, Texas, and New York are no longer substantially better than the rest of the states, since now it is using a scale of 100,000 people.
This tabular heat map here is not as useful as the geographical one because it adds to the cognitive burden.
Yeah, so now we'll just evaluate NPR's data story pertaining to US hospitals.
First, the view presented to us is trying to tell the audience that hospitals are under extreme stress. However, this is mostly communicated through the text. The decision to use a stacked area chart was a good one, however. The legend, which designates low to extreme uses of hospital beds for COVID related issues, could be done better.
Now, what do we mean by better? Well, the page itself also shows how many ICU beds are in use on a state level for COVID-19. And to some extent, this is useful because you can kind of derive a data story in that, oh, okay, so in some of these cases, there was 2 waves, like in the case of California or Maryland. And in some cases, like Georgia and New York and Rhode Island, where it's extreme, there was a giant spike near the Christmas holidays.
And certainly principles of simplicity and parsimony are true most of the time. NCK notes that in these two graphs, the transition from the left graph to the right is far better in terms of storytelling because the prescriptive range is highlighted, thus helping the audience understand what level and price for this example is recommended. However, this visualization is not one of those cases that fall under most of the time as it pertains to the discussion of parsimony versus complexity.
To put it simply, battling COVID-19 is a national project, and there are group members that need special motivation as their skepticism does not allow for high-level parsimonious abstractions by the data modelers.
Indeed, NCK make note of the necessity for the data analyst helping the audience to understand and take action. Notably, they explicitly mention that the audience may not know better.
So here is an alternative, and it's provided to us by the Health Department of the state of Arizona. This is also a stacked area chart, and it introduces a bit more complexity, but not by an awful amount. It provides the user the ability to hover across the visualization and pinpoint the number of beds used on a daily basis. As you can see, the mouse is over a specific area, and it shows you the percentage of beds that are available or unavailable or used for COVID, and it also gives you the raw aggregate amount. The additional detail is useful because it gives skeptics verifiable data points that, if sincere, they can look up by calling up their hospitals to double check. Because dealing with COVID-19 is sort of like a group project where every member needs to participate, every opportunity to motivate these members need to be exhausted.
In all honesty, we could even include images of patients in the ICU beds with their faces blurred out. This pandemic requires empirical substance in regards to information battles and emotional substance as it pertains to messaging.
Yeah, in normal circumstances, this level of abstraction and parsimony is quite effective because you're just communicating ICU bed usage. And in terms of geographical visualization, this visualization we have before you is quite useful. But in regards to the stacked charts, we find that the information needs to be much more heavier and needs to have more impetus.
Let's take a look at the component of the dashboard that presents US vaccine information.
Once again, the hexagonal heat map is used quite effectively. The decision to reduce the complexity in this case and only present information that directly answers the question listed above is appropriate for the audience. The question being which states have vaccinated more of their population.
To add to what Asif said regarding complexity being required for specific audiences, the issue of vaccination information is not something NPR would need to cover in great detail. As we can see in this slide, the dashboard by the Health Department in Arizona provides a much more informative visualization on the matter. The difference between the hospital beds and vaccinations is that NPR is talking to a national audience, which means the viewers are looking at all state level data in cursory fashion. The facts don't convince anyone because they don't relate to anyone. They don't mean anything. Asif's point on hospital beds is a tangible example. The beds being used by victims, so the fact of high ICU usage is connected by the humans that are physically on ventilators on the bed. The emotional work in vaccine statistics is not really relevant because it's a process that happens within a matter of minutes, and details are more necessary at the state level where they administer the vaccines.
Yeah, exactly. So on the state level, they're more coordinating logistics, whereas on a national level, you're trying to raise awareness of the pandemic's dire consequences to people that do get infected with it. So for a macro level, this type of parsimonious detail by NPR is quite useful to just communicate, like, how much of the population has been vaccinated. And finally, the last component of the dashboard involves comparison between the data across the world. And the first thing that sticks out from their table data is that more than 100 million infections have been reported, and the death toll is like quite high. It's almost 3 million. That's a little bit higher than $2.5 million. And the main victims coming from USA, India, and Brazil. However, the table data itself is not the best visualization for this type of information. And NCK does have some interesting insights in this matter.
These three charts depict a story in which the animation tells the audience of a specific chain of events that took place prior to this video game creator's success. Obviously, the final visualization is not one that lacks in detail and is quite text heavy.
Yeah, so similar to what Andrea highlighted above, the choice of NPR to create these pseudo animations, they're not exactly GIFs, but they are clickable transformative graphs that animate salient changes. They do fill the function that NCK was talking about here, where you want to use some type of movement to demonstrate contrast. So, what's even better here than their example is that there's even less text. So we can already know that there are some new cases per 100K that is being riled up in Central and Eastern EU. And we can kind of hypothesize that the reason for this might have been that Americans' infection rate has slowed down as they have secured more vaccines, while EU's per 100K has been going up in this past week. This data is March 8. We scraped this data. We used this data from earlier this week. And that might have been the case because Moderna's vaccine supply earlier this week and also last week has been delayed in the EU. So that inference is only made possible by this graphic.
We liked NPR's use of clickable transitions to animate geographical data and explain a data story pertaining to infection rates. We decided to add this graphic because our group's final project also deals with geographic data, and in the case another group was wondering of alternative ways to demonstrate such information. This stacked bar graph and its corresponding labels is also an effective way to demonstrate geographic data changes over time.
Yeah, so each data stack itself already demonstrates the change, like the red bar here, it sort of demonstrates the change for a geographical location without having a map. So finally, we really liked NCK's idea regarding signals to offload cognitive burden. This is quite relevant to our final project once again. because we're using geographic information which changes over time, and Andrea can expand on that.
Here we have another stacked area chart, but this time with the mouse over, allowing a user to look for specific regions of the world. This option is good, but only to the extent that it blurs things out that may not be salient to the audience. What would make NPR's feature even better and utilize NCK's suggestion of using preemptive signals to offload cognitive burden would be if the NPR web designers use the browser's cookies to recognize the area of the world the viewer is from and already highlight that particular area's corresponding data.
Yeah, and in regards to our project, because our audience is going to be this class primarily from North America, and some of our students are from East Asia, we were also going to use this sort of stack area graph, and we would also, as Andrea just suggested, pre-highlight North America and Asia. That about concludes the presentation. If you have any questions, feel free to ask us.